we all know the symptoms of a cold. Cough, runny nose, congestion. But what's the deal when some kids seem to have that never-ending cold? That constant dripping that no amount of wiping can help. This happens a lot, guys. I know this. Okay, as we look into this issue with a couple of experts from Ohio ENT and allergy physicians, we'll learn the importance of this team approach to care. So we have Dr. Evan Tobin and Dr. Roger Friedman joining me today. So thanks for being here, guys.
Thanks for having us.
Okay, so I have an almost 3-year-old. So this was, to me, something like, okay, this is why I buy bulk boogie wipes, because I feel like this happens, and it happens to kids at various times where you might not think it's cold season or something like that. So Dr. Friedman, I want to start with you because you're an allergist.
Correct.
Dr. Tobin deals in the ENT world. You guys merge a lot. So talk about kind of why those specialties can merge.
And it's actually why we had our merger of Ohio ENT with the allergist. And we now have over 20 ear, nose, and throat surgeons and 7 allergists who practice together. And we practice really synergistically in that the two groups work in the same area of the body. We both work in the nose area, in the sinus areas, in the larynx, and in the lower airways with asthma. And by having two groups together, we can simplify the approach for patients. We can make sure that patients can see one group and get taken care of no matter what is wrong. We may deal with allergies, we may deal with chronic ear disease, sinus disease. Dr. Tobin's going to talk about some of those specifics, but whatever it is, if the patient's referred to Ohio ENT and allergy, they're able to be taken care of by either one of these groups or both of them.
Right, all under one roof, and that's what people look for, right?
That's absolutely right. Very, very, very simplistic and very good for referring physicians and for families.
Yeah, exactly. All right, Dr. Tobin, so let's get into kind of that never-ending cold scenario. What could it be? What do you get a lot of people that come in and think they know what it is and then are surprised it's not?
Well, first of all, oftentimes they're right. It is an ENT problem, a sinus problem, and the typical patient, and let's take your 3-year-old, a mom might bring their child in chronically mouth breathing, never-ending runny nose, maybe snoring at night, or has been diagnosed with sinus infections. And so we'll get a good history, we'll examine the child, and that exam is a pretty routine exam. We'll look in the mouth, we'll look in the nose, check the ears, because oftentimes ear problems will manifest with sinus problems. And occasionally we'll look a little bit more by using a small endoscope that allows us to look further back into the nasal passages and check the very back where we find the adenoid tissue. And it's that adenoid tissue, especially in these 3-year-olds, that can become enlarged and lead to blockage and lead to runny noses and sinus problems. And so we'll start basic treatment, which is nasal saline spray or even a nasal saline rinse, which surprisingly kids can do, and add something like a topical nasal steroid. And then many children see significant improvement. And those kids that don't improve, we might find that there is a significant enough problem that we can address it, we can correct it, and there may even be some minor surgical options that we discuss with parents. But in the kids that maybe aren't improving with medicine and we don't see an obvious anatomical blockage or obstruction, that's when we're going to dig a little bit deeper. We might get x-rays, we might even do a CT scan, which we do in the office, and then that's where we get into allergy evaluation, testing,
You might
treatment.
throw it over to
right.
Dr. Friedman and say, hey, we can't figure out exactly what's going on. Can you take a look and see if something that you can do will help this patient, right?
That's exactly right. And then, again, after Dr. Tobin and his ENT folks have said, okay, we don't think it's anatomy, we don't think it's enlarged adenoids or tonsils, or maybe it's not a chronic ear disease that they think needs ear tubes or surgery, then we know that allergies can cause so many of these problems also, and we can, again, seamlessly be seen in the same office facility and have allergy testing done to see if they do have allergies and then consider our allergy medical treatments.
I got to ask, what's the current allergy season like? Because last year, I think we were saying it was the worst one ever. It was awful.
Well, we say that every year.
Exactly.
That's part of our marketing department. And we always say this is going to be the worst year ever.
Job security. Yeah. Come on in.
It was a really bad May.
Yeah.
Soon upon us is going to be the ragweed hay fever season. And that starts every year between August the 10th and August the 15th. So literally 10 days away. And will this be a bad year? It depends on the weather. If the weather is beautiful and we have lots of sunny days, lots of windy days without much rain, it will be a terrible allergy season. Because once the pollen gets in the air, once the ragweed gets in the air, it stays there until it's washed out.
Right.
And so now on the other hand, if we have rain every other day, then it won't be so bad for the ragweed people. People with mold allergies and sinus disease, it may be a bit worse for them.
Okay, so really, I think what you need to do, though, is see the people who know how to help you. I mean, there's tons of ways to calm your allergies.
Right, and we know the most important thing with allergic rhinitis is avoidance, trying to stay away from things that we're allergic to. Number 2 is taking medications, and again, what Dr. Tobin talked about, nasal sprays, sinus rinses can be very helpful for both allergies and sinus. And then antihistamines may be helpful, and of course, it's a little too late for this year, but allergy shots are our most effective long-term treatment because they can actually cure the allergies, and they can make the allergic rhinitis better, sinusitis better, and ear disease better. So it's kind of something that can help almost all the problems, and especially helping to prevent the development of asthma or to treat asthma.
Okay, and it all starts, of course, with an appointment if you want to go and get a consultation, and they can find the right doctors to help you guys. So thank you so much.
Thanks, Robin.
Thank you. Thank you. We work well together.
Yeah, it shows.